Hello and welcome. My name is Dan Moyane. Thanks for joining us for this conversation with Vernon Chorn. He is the CEO of Unity Health. We're going to be touching on a number of very important subjects in the healthcare space. A lot is happening in this space in our country, and of course the future as well has a lot of questions around it. We'll touch on NHI among others, and also we'll look at some of the current primary healthcare trends. But first, let's just begin at the beginning. Welcome, Vernon.
Thank you.
Nice to have you. Nice to meet you. It's a pleasure indeed. Many people know you as the CEO of Unity Health. I think you've been doing this job for 10 years now or so, if I'm not wrong. But you've done other things in the past. If you look back at all of them, which one best defines you today?
I mean, certainly where I am now is I'm really happy to be where I am right now. I've been through, life's a journey. You go through various things, and I think you need to be happy with where you are, and the journey, so to speak. So I did spend some time in America, also working for AIG in fact, I was there during the financial crisis. So it was a really interesting time in New York City.
Lots of lessons, I guess.
And working in healthcare then as well, but largely focusing on direct marketing when I was there. And then previously, when I was in South Africa, also just working in healthcare. So
yeah, would you say healthcare is your sweet spot?
Absolutely, yeah.
What do you love about it?
Well, I think it's a very dynamic environment. It's changing a lot as opposed to other insurance environments. Healthcare is continuously changing in terms of new developments, new ways of doing things, new ways of treating patients, new ways of engaging with patients or members. So it's a dynamic environment, very dynamic environment. So so you never get bored.
Let's talk about primary healthcare. You've mentioned already the issue of primary healthcare. How does it fit in with the healthcare industry in terms of the whole landscape?
So primary healthcare is largely the out-of-hospital benefits, right? So the treatment for GP visits, the medication that goes with it, testing, so lab tests, pathology tests, X-rays if you need X-rays, etc. And it's very preventative in nature, right? Often you detect, someone's got high blood pressure, they've got high cholesterol, they've got borderline diabetes, etc., and you can intervene and treat them, so you can actually save in terms of the long-term cost. So it actually helps, and it also helps the person at the end of the day, because the person's going to be healthier, live longer, be more productive in the economy, etc., and be there for their family at the end of the day. So I think it plays a very important role in the landscape, absolutely.
Yeah, but to access primary healthcare, you need support, and then people need some kind of medical aid, or do they need medical insurance? What's the difference?
So medical schemes are regulated by the Council for Medical Schemes. Medical schemes have to offer a minimum benefit package to their members, which is largely hospitalization benefits and chronic illness benefits. And on the insurance side, that's regulated by the Short-Term or Long-Term Insurance Acts, and there's no minimum benefit package relating to insurance benefits currently. So for primary healthcare, you can operate under an insurance license, but you need to get exemption from the Council for Medical Schemes because you're effectively doing the business of a medical scheme.
Let's talk about the access and affordability discussion, which is very big in healthcare in South Africa still today. You've mentioned that Unity Health has a particular approach in terms of making sure that people who can afford the insurance can access what they need across the country.
So we've set up networks of providers around the country for GPs, dentists, pathology, radiology, optometry, and also we've contracted with all the hospital groups. And we do that at negotiated tariffs, which is the lower the tariff that we can negotiate, obviously we can pass that on to the consumer through lower premium rates. So that's kind of our approach, is to have that network approach and to make it as affordable as possible to the member at the end of the day. And I think it's also better, it also optimizes the whole management of the providers at the end of the day. So we can manage the providers in a better way, which will actually benefit the members at the end of the day as well.
And there's scope for growth, for growing your network?
Absolutely. So it's an ongoing process. So we add new doctors on an ongoing basis where we see there's a gap and there aren't any doctors, but there might be new members that are joining. And we only know when there's new members joining because there's a gap there, right? So then we can't really sign up a doctor when we don't have any patients to send him. So it's a little bit of a chicken and egg situation. But it's an ongoing process where we develop the network. We have close to 4,000 GPs in our network currently.
So that basic insurance would assist you to give you that access, because affordability also goes hand in hand with access.
Yes,
in terms of healthcare. So what are the trends? What are you seeing? Is there growth in the take up or uptake of primary healthcare insurance currently in South Africa?
Absolutely. So we've seen a growth throughout the years. During the COVID years, we didn't actually see growth for obvious reasons. We had people resigning because they lost their jobs, those types of things. Since about 2021, we've seen significant growth again, about 25 to 30% growth per annum in our membership. And I think elsewhere they're probably experiencing similar type of trends. And we expect significant growth into the future.
I was about to ask about sustainability. Do you think you can sustain the levels of growth?
Absolutely, yeah. So, next year, I would say we probably expect between 30 and 50% growth. It's quite significant.
You've got data. What are you seeing in terms of the treatments that are commonly used by South Africans or needed in terms of primary healthcare today?
So GP visits are the most utilized at the moment. And within GP visits, it's usually the flu, the respiratory type of illnesses that people need to go to the doctor. Maybe they have a infection, whatever, they need to get antibiotics. Other things that we've seen an uptick in, and it's, we saw that in COVID as well, is the psychosocial type of visits. So people are struggling mentally as well.
Yeah, there's been an upsurge in mental health challenges currently.
Yeah. So now, just because of load shedding, for example, people are struggling. It's just difficult, There's challenges around that, and they struggle mentally, and there's, I think, financial hardship.
And those kind of visits are covered under the primary health care.
So they covered under GP visits if you need to get medication, for example, or they also covered. We have a trauma counselling line where you can phone in you can speak to a trained psychologist, and you can discuss your issues and difficulties and challenges with them.
Yeah, access as well becomes an issue. So in terms of industry trends, are you finding that besides people taking them up because they're affordable and they can use them for whatever needs, they're able to access various facilities quite easily using their primary healthcare insurance?
Our approach is to set up a network of providers around the country. So we got over 4,000 doctors that we've contracted with across the country. We have an app, or we can also a web service where you can actually search for a provider, and you can find a provider quite close to your area. It does this mapping exercise. So you put in your location, and it can tell you, the top 10 doctors that are closest to you. So access is quite easy.
Yeah, I want to talk to you now about NHI. That's the big elephant in the health room in South Africa today. National Assembly recently passing the bill. We're still waiting for the National Council of Provinces to do the same, but there's still questions, and it might even face legal challenges from the comments we've had, because some stakeholders feel that they have not been given enough time to contribute, or their contributions were not taken into consideration. So a number of varieties. But from Unity Health's perspective, when you look at NHI, would it have a big impact on the primary healthcare insurance business?
Well, Dan, it's unclear, because right now we don't really know what benefits are going to be offered under NHI. They're aiming to cover a fair wide range of benefits, but it's difficult to tell at this point in time. So we don't really know how our primary healthcare will be affected. We do know that it's probably going to take some time, probably about 2-3 years before the final bill will actually fall in front of the president's eyes to be signed. I think from our point of view, we've looked at it in a different way. So we looked at it from a funding point of view. And I think there's some major funding challenges for NHI going forward. Having said that, it's a really good thing. NHI is a really good thing. And particularly for those vulnerable groups in society that can't even afford primary healthcare insurance, just to be able to access some level of social benefits.
Yeah, recently, you in your business update, a recent one, you point out the fact that the economy is not growing. Yeah. And the tax base is tight at the moment. To fund NHI, you're going to need to centralize these sources. You might have to increase taxation, but currently the taxpayer in South Africa is really, really facing a tough time. But you make the point that for this fund to really get the money, you need to do certain things differently and be aware of future trends. what might impact on it, including population growth?
So one of the things that we've been looking at is, and it's a worldwide phenomenon, it's not just South Africa. So worldwide, we expect the population before the end of the century to start declining. And obviously during that period, it's aging. Well, it's aging all the time. So what happens with an aging population is that you have a high proportion of people that are retired, above 65 all the time. And people that are retired generally spend less than people that are in working age. So your GDP, becomes under significant strain.
And your tax base gets more reduced.
Tax base gets more reduced. So your consumers, which is everyone, versus your producers, that ratio starts increasing dramatically. So there's a stress on the producers to produce more, to sustain the economy. But also the consumers above 65 aren't necessarily spending as much as they used to. So that places pressure on GDP, which places...
And they need more healthcare.
And they need more healthcare. So their utilization goes up as well as they age. Not a lot of people are making provision for their retirement, so we're finding about 80% of people, probably more than 80% of people currently in the working age population that hasn't made any provision for their retirement. So once they reach retirement, they're not going to have a lot of money to spend. So that's also going to put pressure on the GDP going forward, and obviously to collect taxes. You need strong growth in your GDP to collect taxes to fund NHI.
So for you as Unity Health, you see the issue of funding of NHI being a critical one. The government, the way they've presented it is that they want to make sure that one day all of us, all citizens, have access to NHI, and then it's fully implementable. It's fully implemented.
It is important to have NHI. It's important to have social benefits for the country, because there's so many people that can't access private healthcare, and they need healthcare benefits, and it's very important for them to have that level of benefits available to them.
Let's focus now. Let's come to talk about Unity Health now in terms of next year. As we approach 2024, you've made the point several times that the majority of us in South Africa cannot afford and access quality health care. Cost of living, you've pointed out, has skyrocketed. I mean, the numbers are crazy. But what options and products are you guys looking at, you at Unity Health have to assist?
Thanks, Dan. Yeah, so our product is fairly complete. So over the 10 years that we've been in existence, we've got a fairly complete product. So it's really just focusing on small changes in terms of the product. So we're increasing the benefit limits for next year. Obviously, that's an annual thing that we normally do. And we are introducing a new product, hospital cash plans. The hospital cash plan does cover maternity benefits, but you have to pay directly to the member. It's not you don't pay the hospital as a service provider, and the limits are a bit lower. So we're offering a 20,000 Rand childbirth benefit, and then also a daily cash benefit of 2,000 Rand a day for each day spent in hospital for next year. So the other thing we're also doing in relation to the GP visits is in terms of processes, is that we're going to introduce a nurse care line.
Why have you introduced it?
So we want to be more engaging with our members. And so members are going to be phoning in to the nurse call center, and we'll guide them to see a GP online or face-to-face, call the trauma counseling line, or go see a nurse. Okay, so we want to get a better understanding of what's going on with the patient, engage them and guide them, educate them.
Tariff increases, what should Unity Health customers brace themselves for?
We're expecting medical inflation or tariff or say contribution increases for next year to be anywhere between 7, 8, 9, 10%, possibly even. We're going to try and keep ours down to probably between 7 and 7.5%. We're quite tight on how we manage our utilization, and so that's something that we want to pass on to, obviously, to the members through lower increases. It seems a bit high, but relative to the rest of the market, I think we're probably going to be on the lowest end of the scale. Remember, we have to pay. We're expecting hospital groups to come through between 7 and 8% tariff increases for next year, and we'll probably pay the providers that we contract or set the tariffs for, like doctors and dentists, etc. Between 5 and 6%, we'll probably increase their tariffs by.
Okay. Future-wise, primary healthcare, where do you see it going, Vernon?
We certainly see a significant growth going forward. We've seen significant growth come up to this point, except during the COVID years was a bit of a difficult period. But since then, we've seen strong growth, and we expect strong growth going into the future.
Okay, Vernon, thank you very much for our conversation. This time, it looks like you've got an exciting time ahead of you and challenges as well. Thank you very much.
Thank you, Dan.
Thank you.